Welcome to True Health Tuesday, and the truth will set you free. Today we're talking about mental illness. And now, please like this video, share this vital life-saving information, and subscribe to our channel. It's going to help our channel grow and spread this information, which is nowadays. Now, let's look at natural solutions for mental illness. Now, this was inspired by a question from YouTube from Butu. Please make a video on bipolar disorder and schizophrenia. Fantastic. Okay, number one, we have to look at the fight or flight response because in bipolar disorder, schizophrenia, attention deficit disorder, all of these are features of a part of the brain called the frontal lobe. And when you're in the fight or flight state, this puts you, and you have this automatic nervous system. One part keeps you alive under stress, the other part regenerates tissue. So fight or flight state, short-term memory is decreased, long-term memory is activated. You got to run away from that tiger. So digestion is affected. Everything is affected based on this stress state. Now, the first response is the amygdala. Now, this is the emotional processing area of the brain. So this perceives danger, okay, and instantly sends a distress signal to the hypothalamus. The hypothalamus is amazing. Okay, now the hypothalamus, you're looking, it produces direct hormones, like in antidiuretic hormones, oxytocin, which is the love hormone, dopamine, which is amazing, has a calming effect, corticotropins, gonadotropins, releasing hormones, somatostatin, growth hormones, vasopressin, everything. And then the thyroid gland, you're looking at thyrodoxythyroid, thyroxine, and then the pituitary gland. So all of these hormones based on your stress level or your perceived stress, you're looking at growth hormones, luteinizing hormones, follicle stimulating hormones, prolactin. All of these hormones are affected by your perception of stress. Now, the hypothalamus maintains homeostasis, that's your balance. And the hypothalamus is unique because you have two communication pathways. You have a chemical and an electrical system, or endocrine and nervous system. The hypothalamus has its foot in both of those. Now, it gets its information from the position and motion of the vertebrae. So that central nervous system communicates to the hypothalamus, and then it responds to the danger. Now, hypothalamus, command center of the body, controls breathing, blood pressure, heartbeat, blood dilation and constriction, communicates with the automatic nervous system or autonomic nervous system, and activates that fight or flight or sympathetic nervous system. And every human being has this automatic nervous system. And the way I explain it to patients is every human being has a switch. You can be on stress response or regeneration, stress or regeneration. And this activates that stress response, that fight or flight. And when you're running away from a tiger, literally blood supply to the gut shuts down. The liver starts to break glycogen out of glucose, so blood sugar goes up. And so you can activate and run away from danger. Now, the hypothalamus and the rest of the HPA, hypothalamus, pituitary, adrenal axis. Now, in a chronic state of stress, you're looking at a cascade of symptoms, and eventually it results in your inability to regenerate. So we're talking major dysfunctions. And it's super important to identify when a person is in a chronically stressed state. Now, what are some of the signs? Now, and I love this, blood pressure regulation, because right now people, in the medical profession, they're going to check your blood pressure and they'll say, well, it's too high or too low based on their perception. And the leading cause of high blood pressure officially is unknown. No, it's the body responding correctly based on its perception of stress. You're looking at water retention or dehydration, weight loss or gain, typically weight in the belly, seat, and thighs. That's cortisol. Poor bone health, delayed puberty, muscle weakness, loss, body temperature, and depressive mood disorders. And overstimulated or chronic thyroid, just like you have this automatic nervous system, sympathetic, parasympathetic, stress or regeneration. You have the adrenals and thyroid. The thyroid, when the adrenals are activated, the thyroid is suppressed. And when it gets exhausted, and this is called, um, exhausted thyroid, depression, heart disease, fibromyalgia, menstrual symptoms, all of these are the body in a chronic state of stress. Menstrual issues, hair loss, because the body is having trouble regenerating tissue. So, non essential like hair, skin, nails, those are all affected. Stress in the adrenals, adrenal fatigue. Adrenal fatigue occurs under a chronic state of physical, chemical, or emotional stress. And again, you're looking at memory loss. Short term memory does not work. Look at a brain fog, depression, inflammatory conditions because the body can't regenerate tissue, confusion, cognitive impairment. Now, the adaptation to chronic stress, this is a sympathetic dominant or fight or flight state. And the digestive, reproductive, endocrine, all of these things are depressed because your body has to run away from that tiger. And it literally breaks down. You're looking at insulin producing, the pancreas starts to break down, thyroid, ovaries, parathyroid, pineal, pituitary, everything. And the final length is that hypothalamus. Now, neurotransmitter imbalance. Remember, your neurotransmitters, it's called the gut-brain connection or the enteric brain. And when you're in a chronic fight or flight state, blood supplied to that gut function, which is under parasympathetic control, is decreased. So you're looking at brain fog, ADD, ADHD, impaired memory, fatigue, insomnia, pain, obesity, particularly belly, seat, and thigh, weight distribution, mood disorders, panic attack, anxiety, hormonal imbalances. Now, neurotransmitters control communication throughout your body and brain. Neurotransmitters chemically link the brain and spinal cord with the rest of your body, muscles, organs, glands. Now, serotonin, it's biochemically derived from tryptophan. 90% of the total body's serotonin is in the gut flora. This is why it's called the gut brain or enteric brain. And these cells that produce this, the enterochromaffin cells, are very sensitive to toxins, bacteria, viruses, irradiation, chemotherapy. This is why they call it chemo brain. Now, according to the Journal of Psychiatry and Neuroscience, little is known about the specific contribution of serotonin to the neurobiology of emotion and mood in healthy people. It's let's just look at the functions of serotonin. It regulates intestinal movement, regulates mood, appetite, sleep, plays a role in cognitive and memory function, learning. It literally affects all the organ development. Now, dopamine is a chemical released by nerve cells to send signal to other nerve cells. Now, reward motivating behavior. Dopamine is fantastic. And it's some of the most addictive drugs increase dopamine neural activity and inhibits norepinephrine release. Now, low levels of dopamine, Parkinson's, and particularly in the midbrain area, substantia nigra. This is why when we're looking to reverse Parkinson's, we have to look at the physical structure, because if there's forward head carriage, loss of curve in the neck, this can literally pull on the brainstem, negatively affecting dopamine production. Schizophrenia, again, that's frontal lobe dysfunction. ADD, ADHD, restless leg syndrome. Why is restless leg syndrome? Well, movement triggers dopamine. This is why you're going to see when people are constantly bouncing their leg, or they start to get a tremor like this, it's their body trying to get stimulus to that brain to generate that dopamine. Now, movement increases dopamine production. This is why when you look at people who have those movement disorders or they have intention tremors, it literally, they're doing everything they can to generate dopamine. Now, it vasodilates, reduces insulin production in the pancreas, digestive system. You're talking reduces gastrointestinal motility, protects the intestinal mucosa. So dopamine is amazing. And when we look at depressive disorders, clinical depression, bipolar, anxiety, seasonal affective disorder, borderline personality disorder, PTSD, atypical depression, melancholy, catatonic depression, postpartum depression. All of these are the body under extreme stress. It literally starts to shut down. So, what is the first step? Okay, the first step, you have to address the stressors. And every time, every patient I get, I say we have to address the stressors: physical, chemical, and emotional. We're all living on a three-legged stool. You have to address the physical, chemical, emotional stress. Why? Because all of these activate that fight or flight system. So the questions you have to ask and the quality of questions are going to massively affect your life. What am I toxic with? What am I deficient in? Why do I have these symptoms? Okay, so this empowers the patient with the correct questions. Number one, avoid the vaccines. Okay, we can't say that clearly, but understand that if you're getting certain injections, this can trigger a Th2 or inflammatory response, and it can activate that stress response. Medications. When you look at the effects of the medications, people call them side effects. The medications typically cause the symptom they're designed to treat. And no one's suffering from a lack of medications. Environmental toxins, non-organic GMO foods, all of these can negatively affect the gut flora. Nutritional deficiencies, chronic states of stress. You have to address those. Now, medications known to cause depression, you're looking at benzodiazepams, at all the blood pressure drugs, beta blockers, methyl-dopa, calcium channel blockers, ACE inhibitors, corticosteroids, contraceptives, sedatives, opioids, painkillers, amphetamines, even antidepressants cause depression. It's in their affects things. The worst thing is Accutane, an antibiotic for treatment of acne that destroys the gut flora. Oral contraceptives, all the blood pressure drugs, the statin drugs for cholesterol. It's interesting that in Psychosomatic Medicine 2000, Dutch researchers studied 30,000 men and found that low cholesterol levels increased the risk of depression. Why would that be? They found with men with chronically low cholesterol levels showed a consistent higher risk of having depressive symptoms along with anger, hostility, and impulsivity. Why is that? Well, let's look at what the function of cholesterol is. Cholesterol doesn't clog arteries. Cholesterol is the precursor to every stress hormone that you make, every glucocorticosteroid, mineralocorticosteroid, sex hormone. It's the precursor to most of the hormones you make. Then it's 50% of the way to the brain. It has a function. Cholesterol is elevated under physical, chemical, emotional stress to help you adapt. So to chemically lower that is not a good idea. Let's look at drugs that cause mania, corticosteroids, and this is hydrocortisone, Flonase, prednisone, Nasocort, Flonex, cyclosporin. Now, these are drugs used to suppress the immune system to prevent organ transplant rejection. Parkinson's medications, muscle relaxants, and antispasmodic agents. Now, remember, the spasm, the muscle movement, is the body trying to adapt to that stress. The MAOIs to treat depression, Nardil, Parnate, Ritalin, the most drug traded on college campuses, SSRIs, the drugs used to treat depression like Prozac, Lexapro, Paxil, all have a side effect or the effect of causing depression. Synthroid, Artane, the drugs to treat Parkinson's, Yohimbe, a drug to treat male impotence. So let's look at the 5 keys to health, because you have to address all 5 keys. And if you do, then your body can function correctly. Proper nerve supply, that's huge. Number 1, every human being has this automatic nervous system. Every human being has 2 switches. You can be in stress or regeneration. When you're in stress, blood supply to the gut shuts down. The heart rate elevates. Cholesterol elevates. Blood sugar elevates. All to respond in short-term stress. The other half, rest, digest, and repair. Now, the parasympathetic nervous system is located in the cervical spine and the pelvis. So if you look at your big toe, if your big toes leaning towards your other toes, that typically means that the nerves that supply the foot are compromised, and those comes out right of the thoracolumbar junction. And I mean, right out of the sacral lumbar junction. So these nerves, if you see a deformation of that foot, it means that the lower lumbar and sacrum could be negatively affected. So that's a big red flashing light that your parasympathetic, or your ability to rest, digest, and repair, is compromised from a physical stressor. Now, what is health? Remember, the quality of questions are literally the key to health. Fever is an intelligent response. High blood pressure, high cholesterol, all of these are intelligent responses by the body. They're not pathological. Now, what disease is, and we always call it dis-ease in chiropractic, it's an unhealthy adaptive response. And this could be the same thing: fever, high blood pressure, high cholesterol. Because if that's chronically elevated, you're not addressing the physical, chemical, and emotional stress. And your nervous system controls and coordinates all the functions of the body, controls hormone functions, controls everything. But that nervous system responds based on your perception of the environment. And an abnormal nervous system response equates to an abnormal adaptive response. And this is a great one to look at how structure alters it. Now, remember, you have a physical nervous system that's housed in this spine. I don't really care about spines, but I do care about if you have an alteration in spinal structures, that spine protects and houses the nervous system that controls every function. And when you're looking at normal on the left and abnormal on the right, X-ray here, you're literally looking at abnormal or abhorrent stimulus to that cerebellum and to that hypothalamus. So you have to look at the physical stressors. This is a perfect example. You can see normal cervical spine in the middle. Now, that brain only weighs a kilo, 2 pounds, burns 90% of the body's oxygen, and it does that by creating its own food called cerebrospinal fluid. That fluid produced in the brain is supposed to drain down through to give nutrients to that spinal cord. Now, if you have an alteration in structure, that fluid cannot drain. Now, if you do have a reverse curve or lost curve in the neck, that pressure can build up inside of the skull. It's called intracranial pressure, and you will feel it. You will have, and I always call it a flaming mohawk in the middle of the skull. If you have tenderness in the top of that skull, the covering of the brain, the meninges, actually invaginate up through those skull sutures. Like, it won't be tender here, won't be tender here, but it'll be tender in the middle. That indicates that there could be intracranial pressure from that fluid not being able to drain. So you've got to look at the structure. Again, what we have here, we have a physical trauma causing altered input into that brain. And that puts you physical, chemical, emotional stress. You've got to correct those physical stressors right away. Now, when we're looking at neuroplasticity, this is it's the function of your spine, how it affects your brain. You have, and this is how chiropractic adjustments can correct that function. You have the position and motion of the vertebrae, but it's that communication to the brain. And this explains how correcting the structure can improve brain function, memory, concentration, and motor function, balance, decision making, and intelligence. And you change brain function, you change physiology. So you have to change the input from the position and motion of the vertebrae to change that communication or that stimulus to the brain. Do you want to learn how to correct this? Absolutely. And we have techniques that non-healthcare professionals can do with their family. You can actually help your family. We have articles, videos, books, apprenticeships, consultation, in-person training, video training courses. All of these explain how to correct those physical stressors. We have adjusting techniques, but you got to know the anatomy and physiology, literally how to reverse disease, because the disease, dis-ease, is the body adapting to abhorrent stimulus or to a chronic state of stress. Case studies, we have employee training for your staff. Absolutely vital. When you have a case like this where they have multiple fusion, you're looking at chronic, abhorrent stimulus to the brain. Quadriplegic 14 months earlier. Now, by adjusting this, you cannot adjust the surgical site, but you can change the stimulus above and below the surgery site. And we literally show you how to do that. Now, go to adaptivephysiology.com. You can create a free account today, get exclusive access to the articles and videos, and we will walk you through how to correct it with the training and everything. Now, regular exercise, movement. Movement is the key. What does regular exercise do? And just like mom used to say, only brush the teeth you want to keep. You only move the joints you want to keep. You got a hunter-gatherer body. And movement is essential for brain function. This is why we give cross-crawl exercises to 100% of our patients. Exercises, it causes you to get good quality sleep. What does that do? That's regeneration. Helps you maintain weight, improves your resistance to infections. Why? Because when you're exercising and respiration, perspiration, these are ways that your body detoxes. It improves brain function. It can prevent and relieve chronic pain, improves your emotional health, reduces cancer, heart disease, diabetes. It's amazing. A sedentary lifestyle, what does the opposite of exercise do? It increases risk of all types of cancers. Why? Because your body isn't allowed to move and generate and detox. Cardiovascular disease, mood disorders, because you're not moving. Memory loss, cognitive decline, depression. Movement is the key. Type 2 diabetes, erectile dysfunction, loss of sex drive, deterioration of the spinal health. Hippocampus and depression. You've got to look at brain function. Now, this is involved in behavioral actions and mood disorders 100% of the time. Now, contributing factors to that hippocampus shrinking. It shrinks in late adulthood because typically people are going to be less active. And this decreases blood flow to the brain. There you go, blood pressure drugs. So blood pressure elevations is the body adapting to a chronic state of stress. It's not pathology. The accumulation of toxins in your brain, and again, some medications and some medical interventions can cross that blood-brain barrier. Sedentary lifestyle is dangerous, according to the Journal of Behavioral Pharmacology. Quote, the available evidence suggests that the hippocampus plays an important role in the pathophysiology of depression and bipolar disorder. Absolutely it does. Now, exercise increases neuroplasticity or brain plasticity. Exercise increases the size of hippocampus, improving memory. Aerobic exercise is vitally important at reversing that hippocampal loss of volume. It increases blood flow to your brain, increases oxygen to that brain. A little 2-pound brain burns 90% of the body's oxygen. It encourages release of accumulated toxins. Moderate exercise can reverse normal brain shrinkage by 2%, effectively reversing age-related hippocampal degeneration by 1 to 2 years. Absolutely, you have to exercise. According to Physiology Review, we demonstrate that loss of hippocampal volume in late adulthood is not inevitable and can be reversed with moderate intensive exercise. What day do you need to exercise? Every day. There's a striking ability of the environment, environmental enrichment, and physical exercise to empower adult brain plasticity. According to James Gordon, MD, world-renowned expert in using mind-body medicine to heal depression. Quote, what we're finding in the research on physical exercise is that exercise is at least as good as antidepressants for helping people who are depressed. Physical exercise changes the level of serotonin in your brain and increases your endorphin levels, making the feel-good hormones. Also, there are amazing studies. Exercise can increase the number of cells in your brain and the region of brain called the hippocampus. Again, exercise, absolutely vital. Proper nutrition. Now, obviously, if man makes it, you don't eat it if you can avoid it. Avoid processed foods, genetically modified organisms, grains, okay, because these things can be typically sprayed with glyphosate, which is an antibiotic, destroying the gut flora. And that we've got the gut brain or enteric brain. Artificially and processed sugars, again, damage the gut flora. Pasteurized or homogenized dairy. This is toxic shards of fat. Unhealthy meats, they have antibiotics and hormones. Unhealthy fats, avoid like crazy the seed oils, corn oil, canola oil, soy. They are toxic. They damage the arteries. They damage the blood vessels that supply the blood vessels, the vasovasorums. It's crazy. This leads to atherosclerotic plaquing, everything. Now, you have a hunter-gatherer body. You have 10,000 generations that preceded you. Your diet should be like them. What did your great-great-great-great-grandmother eat? She only ate organic. She only ate healthy fats, coconut oil, avocados, olive oil, healthy fats from healthy animals, fermented vegetables, probiotic supplements. You got to build that gut flora. Juice your vegetables, blend your fruits. Raw dairy is amazing. Now reduce your animal 6 and increase your animal omega-3 fats. Vitamin D. Look at the healthy fatty fish food sources. Look at direct sunlight exposure. It increases nerve growth in your brain. Elevated concentrations of brain serotonin, omega-3s, and this is anchovy, mackerel, sardine oil. Amazing. It's the single most important nutrient for optimal brain function. Low levels of DHA have been linked to depression, memory loss, schizophrenia, Alzheimer's. Now, vitamin D helps produce serotonin in the brain. Vitamin D activates, increases nerve growth in your brain. Now, the combination of vitamin D, tryptophan, and omega-3 fats can elevate concentrations of brain serotonin without side effects. Vitamin D deficiency, what is it linked to? Digestive disorders, remember, gut brain. Skeletal disorders, osteoporosis, depressive disorders, autism, brain dysfunction, dementia, Alzheimer's, chronic infections, all types of cancers, cardiovascular disease, autoimmune disease, premature aging, and magnesium, absolutely vital. Without minerals, you can't utilize vitamins. Now, magnesium is a mineral used by almost every organ in your body, especially heart, muscles, and kidneys. 80% of Americans are mineral deficient or magnesium deficient. Magnesium is found in more than 300 different enzymes. You have over 3,700 magnesium binding sites on human proteins. Calcium, vitamin K2, vitamin D must be balanced with magnesium to utilize it. Again, without minerals, you can't utilize vitamins. Magnesium deficiency, you're looking at hormone imbalances, pre- and post-menstrual cycles, depression, panic attacks, fibromyalgia, headaches, migraines. So look at the natural food sources of magnesium, dark green leafy vegetables. And again, we're talking organic. Nuts and seeds, squash, pumpkin seeds, mackerel, one of my favorite fish, whole grains, avocados, bananas, dried fruits such as fig, prunes, dates, raisins. Make sure they're sun-dried and they don't have the sulfur in them. Dark chocolate, loaded with magnesium. Make sure it's organic. And then sufficient rest. This is when your body is in your regeneration cycle. Every human being could be in stress or regeneration. Sleep is when it occurs. Now, lack of sleep, again, contributing factor to mental disorders. You're looking at memory loss, Alzheimer's, Parkinson's, dementia, depression disorders. Why is sleep so important? Sleep increases wound healing, activates your immune system, maintains emotional balance. It helps your brain clear its waste, restores your brain's ATP or adenosine triphosphate. I mean, this is the energy source of your body. Helps growth hormone, increases clarity and memory retention, cognitive functions, prevents degenerative diseases. Now, what kind of drugs are our population taking that could limit that sleep? All blood pressure drugs. So you're looking at beta blockers, ACE inhibitors, diuretics, appetite suppressant drugs, antacids, ADD, ADHD, over-the-counter cold medicines, analgesics, corticosteroids, sedative medications used to induce sleep, interrupt sleep, or that healing aspect of sleep. Antihistamine medications, dangerous. Over-the-counter sleep medications, asthma drugs. So what do you do to regain that sleep? Well, number one, if you're prescribed a medication, find why you're prescribed it. Then reduce all the stressors, address the physical, chemical, and emotional stressors. Look at your sleep area, improve that sleep environment, keep a regular sleep schedule. Do our sleep restriction therapy for 21 days, limiting your sleep to 6 hours a night. Avoid excessive stimulation, exercise regularly. You can do emotional freedom technique, neuro-linguistic programming, but realize that your brain goes through these 90-minute cycles called rapid eye movement. Look at our sleep videos because you have to calm the brain down by journaling and reading before bed. Your body goes through these 90-minute cycles. When you complete that 90-minute cycle, your eyes literally open, then they close. So it has to be so dark you can't see your hand in front of your face. So preparing your mind, doing all the aspects to get that deep sleep is vital. Now, prayer and meditation, absolutely essential. That's why we call these the 5 keys to health. So the wellness questions, remember the quality of questions, it improve the quality of your life. Number 1, what intellectual, emotional, or spiritual states are toxic and force adaptive cell function and sickness? Intellectual, emotional, and spiritual. What are the intellectual, emotional, and spiritual requirements for homeostasis and cell health? What are intellectual, emotional, and spiritual choices are necessary to create sufficiency and purity? You can create these in your mind, but when your mind is in a chronic state of stress, you're getting chronic stimulus to the brain, and those neurons start to hardwire in that chronic state of stress. We have to change that programming of the brain and activate that beauty in your mind. Now, the experiences that we've shaped shapes the way our brain is structured. Neurons produce chemical changes in your body, and those neurons, if you're in a chronic state of stress, they wire together, and so they're constantly doing it. You get better at producing stress the more stress that you experience in your brain. You get better at it. It's a skill set. So this reprogramming, learning and repetition can reprogram your subconscious. Now, and I love this. Whatever you hold in your mind will tend to occur in your life. If you continue to believe as you have always believed, you will continue to act as you always have acted. If you continue to act as you always have acted, you will continue to get who you always have gotten. If you want different results in your life or your work, all you have to do is change your mind. And the mind can be changed through repetition because you're looking at the frontal lobe where anxiety, stress, depression, impulse control, schizophrenia. Now, luckily, that frontal lobe can be reprogrammed through repetition, not belief. Now, when you look at feelings, and I love this, Dr. Joe Dispenza's definition is just brilliant. Feeling, your conscious awareness, a chemical produced by your neuronal firings. Body, a massive energy that is an expression of your consistent chemical production and neuronal firings. And I love this because I never ask patients, how are you feeling? Because you only have 10% awareness of your body. Okay, how are you feeling? Well, I'm consciously aware of being emotionally involved in an idea or memory. Therefore, I'm moved into a neuronal firing that produces a chemical response. So my body is actually living a past memory right now called a feeling. It is. When your brain is in a stress state, you're firing in a stress state. We need to change that so you're firing in a thriving state. And you do that through repetition. And just know when we teach neurolinguistic programming, we're talking about body posture, volume, intonation, and breathing. And you're going to be saying, I am healthy, I'm dynamic, I'm vibrant, I'm strong, I'm healed. But also, so that's one. And we recommend that exercise 10 minutes, 3 times a day. And I've been doing that every day for about 24 years. Also, I want your brain to go to a state of joy. Because if I ask you, okay, tell me 4 things that are irritating you about your work, your spouse, your physical body, your physical environment, anything. And you could tell me, oh yeah, well, this is bugging me, this is bugging me, and you could explain that with enthusiasm. But what I want you to do is go to a spot in your mind Okay, and this is we're dealing with the limbic system or the emotional center of the area of the brain. So when you go to this spot, think of a joy when your soul smiled, when you were content. And this is going to be diaphragmatic breathing because you got to oxygenate that brain and visualize where you were. Now, you could be 5 years old, laying on your back on the grass, looking up through the trees, making pictures out of the clouds. You could be with your spouse, holding her, walking along a beach. You could be in a moment when you were a kid, water skiing, and you hit that smooth water. You could be walking through that mountain forest, smelling the pine trees, feeling the crunch of pine needles. So practice getting into that emotion, that physical, that chemical when your soul smiled. And it's going to be hard at the start, really, really hard at the start. But the more you practice it, because you've already practiced chronic states of stress, we have to change that by practicing that, getting in that state of prayer, meditation, connection. And when I first did this, I was instantly transported to a 5-year-old birthday party that my mom gave me. It was a hobo party, and all my friends were there. It was really cool. And then I was instantly transported to right after my dad died when I was 14. My sister's boyfriend, Larry, took me under his wing, and then he introduced me to these Italian carpenters from New York. And they taught me hard work and love and respect and honor. And I mean, just, told me that, just the camaraderie and affection and just amazing. And so your brain can go through these different states, but the more you practice that, the more you can get into that mindset, your mind becomes hardwired for joy. And just like Thomas Edison said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. You can master your emotions. And when you master your emotions, you change your physiology. This is the key to get that regeneration happening. God bless you all. You were made for the world. The world was made for you. Stay healthy, my friends, and share this information.